There are many dentists that do dental implants. The problem is that there's probably not the experience that's needed to be able to place dental implants. And hopefully they'll go ahead and do that. But in the meantime, you want to make sure that your dentist knows what they're doing. The number one question people ask is, have you done this before? And it can't be the first time. It needs to be maybe the 200th time kind of thing. The truth is, when you ask your dentist, just ask them to be honest with you. Have you done this procedure? If they haven't, then you probably want to get maybe another opinion. And something to ask would be, ask about their success rate. Pain and then the word you don't want to hear, pus or virulence, okay? And really a lot of bone loss around an implant. But a little bit of bone loss is normal with an implant, but those are the symptoms of a failing implant. Leaving a space, maybe in the beginning, is not a big issue, but over time we can get a little bit of collapse with the cheek. It may look like that people will notice that there's something missing. A lot of times people come in and they just don't like the space. And there is some tipping of the teeth that can happen too. And so that space can close up and it may be hard to put an implant in later. And the big one, probably the biggest thing, is in the first year after a tooth is taken out, you're going to lose about 30% of the bone. And so even though you may want to do dental implants, if you wait too long, you may not be able to do dental implants. If your implant starts to fail, you need to go to the dentist, go to the person that helped put it in, and just talk to them so they can see if it may be something that's easily fixable. If it's not, then they'll help you kind of figure out a way to do the best you can to maintain the implant. Ultimately, you may have to take out the implant, but that's in a rare case. Dental implants have a very high success rate. If there's a position where you're in where you're having a question about one of your implants, just come see us. We will do a complimentary consult, take a 3D image and help you kind of see where you're at. Sometimes it's not as bad as you think, but certainly we can give you the data and you can decide what you want to do. If you think you may have a failing implant or something that you're really concerned about, just give us a call. Give our office a call and we'll set you up and do a complimentary consult and take care of you. So for more information about implants or new smiles, click the link below.